All right. We'll begin by calling witnesses on the first agenda item, the security and safety of Texas youth at state licensed facilities. I've asked LBB to testify. The chair calls up Julie Lindsay with Health and Human Services Manager at the Legislative Budget Board. If you'd please, thank you for being here. Please state your name and who you represent.
Good afternoon, Julie Lindsay with the Legislative Budget Board. Today I will be going over the presentation in front of you that looks like this, the historical appropriations and expenditures for the Department of Family and Protective Services. And as a reference, this presentation is also being made available on the LBB website. Okay. Yes, yours is red. You got color. Sorry. Trying to be fiscally responsible and print in grayscale. If you would turn with me to slide 3, the graph on this slide compares the agency's appropriations and expenditures from fiscal year 2014 through 2023, as well as providing fiscal year 2004 for additional context. The stacked bar graph depicts the expenditures, with the bottom darker section representing general revenue expenditures and the lighter section on top representing all other funds expended by the agency. The line above represents the all funds appropriations made to the agency. You can see how both general revenue and all funds have increased over both the 10 and the 20-year period. Furthermore, each year has seen an increase in the state funds expended, with the only exception being in fiscal year 2020 and 2021, which is due to the method of finance swap with the Federal Coronavirus Relief Funds, or CRF, that was utilized to free up state funds across all agencies. From fiscal year 2014 to 2023, the agency's all funds expenditures increased from $1.5 billion to $2.4 billion, or 58.5%. The general revenue expenditures increased from $0.7 billion to $1.4 billion, or 92.8%. And from fiscal year 2004, when the Department of Family and Protective Services was named the Department of Protective and Regulatory Services, total expenditures have increased from $0.8 billion, or 186%.
Vice Chair Hinojosa.
Do we know how much of that increase is attributable to the split in the agency and having to take on responsibilities, IT, for example, that they didn't have before?
There is been significant changes in both the scope, the number, and the breadth of the programs of the agency since 2004. Some programs have been added, as you mentioned, IT, since DFPS was moved from the HHS system umbrella, so they would have more internal administrative components. There are some components that moved from DFPS to HHSC, including some of the child care regulation pieces. Some have simply just increased, such as the prevention and early intervention services. They've sort of maintained that, but the scope of those programs have increased, and they've added programs. So there's a lot of different kind of contributing factors that are seeing some of those appropriations go up and down. I don't have that sort of in front of me at this moment. We could certainly work with the agency. They might have a little bit better historical knowledge on the exact dollar amounts going in and out.
So if we were to look at year to year to have a better kind of apples to apples comparison, we'd look at when did the split happen? Was it 2015 or when?
2016.
2016.
Yeah.
So we would look maybe 2016 or 2017 on to get a better.
Yeah, I think 2017-18 that's okay. The biennial really where it looks very similar to the way that it looks now. Okay. But that being said, on some of the later slides, there are you are able to make some of the comparisons longitudinally, such as, the CPS direct delivery staff, has been a function. It was there in 2004. It continues to be a function. So some of the more the core functions, I think you are able to make that comparison, but it's a little bit harder at the agency-wide all funds level, but I do think 17 is probably a good year to sort of pinpoint. Okay. If you would move with me to slide 4. Here we have provided the historical full-time equivalents, or FTE positions, appropriated to the agency over the same time period. And on this graph, the top line reflects the total FTE appropriations to the agency, with the line below showing the FTEs appropriated to the Child Protective Services, or CPS, Direct Delivery Staff Program. So from fiscal year 2014 to 2023, the agency's FTEs have increased by 4.2%, while the CPS FTEs have increased by 9.5%. And since fiscal year 2004, the agency's FTEs have increased by 87.4%, while the CPS FTEs have increased by 108%. And as we were discussing, this is mainly due to some of the changes in the scope and the volume of the agency functions. However, if you start looking in fiscal year 2014, the overall FTE appropriations have increased over the 10-year period. There's been some fluctuation in the year-over-year trends, and this is due primarily to the transfer of the Child Care Regulation and Adult Protective Services Facility and Provider Investigation functions that was transferred to the Health and Human Services Commission pursuant to Senate Bill 200 of the 84th legislative session. This accounts for a decrease of 887.9 FTEs from fiscal year 2017 to fiscal year 2018. In addition, we have the rollout of community-based care, or CBC, and beginning in fiscal year 2019, the state CPS employees were reduced to reflect the transition of those services to the single source continuum contractors, or SSCCs, who are now providing those services within the CBC model. And the actual reductions related to those transitions beginning in fiscal year 19 are provided at the bottom of the slide for your reference.
Okay, if I could I just want to clarify how y'all are accounting for that, because there was some discussion in the Senate on this, and I think that it may have been a double counting, because there's the total today. We think we've transferred 735 total.
Correct.
So it's the 61 is the incremental transfer that year. There's another 409 the following year for a total that would have been transferred of, 470. And then the 265 is the increment, but that's just
Yes.
the incremental.
I see.
And so
Yes.
the 75, so right now, if I'm reading it right, we have the equivalent of we're funding, because we're paying for the CBC employee through contract, 735 people. You would add that, if you wanted to say how many FTEs are we paying for through employee or contract, it'd be 735 on top of the 12,007.
Correct.
That makes sense? Because we are now paying a third party to do what was being done by our FTE. But we're still paying for the FTE.
Correct.
Through contract.
Yes.
It's just,
yes.
which is what you're trying to show.
Yes.
So it's not reflected in here.
So it is not, so the CBC
Yes.
employees are not reflected in
That
the
is
chart itself.
correct. Yes, because they are no longer state
No longer state
employees,
employees.
so they are not on the FTE model, but they are provided the new FTEs that were transitioned at the table. So yes, it would be additive. If you want to know how many in 2020 were being contracted, it would be the 19 plus 20. So Representative Frank's explanation was correct.
So hypothetically, if we wanted to say, hey, we would like a chart that would include FTEs on there for both, to how many, essentially, how many resources, how many people we're paying, irrespective of whether or not they're state employees or FTEs, I would like that. I think that is at least one other intelligent way to look at it, because ultimately those are boots on the ground that we have with the kids, right, that we
Yes.
are paying for as a state. We're either paying for them effectively or we're not. But they are people who are working, supposed to be working with kids.
Yes, we can provide that.
Thank you. And by the way, I appreciate you adding, just so y'all know, the context that was added. I asked them last minute to add the 2004. That's why the rest of that's not there. She's going to fill that in. But it was a bit last minute. That wasn't to try to, I really don't like data manipulation. Actually, I said, would you please put a chart there so it's clear? I am trying to make the point we have kept putting money in again and again and expecting different results, and sometimes I think we have to look at how are we spending money. We may also need to spend more money, right? It's not that, but the effort, if measured by money, has been there because I think again, that's not the only way to measure it, but I think in Chart 3, we spent $225 million out of state funds in 2004 and almost $1.4 billion last year.
That is correct.
Or I'm sorry, that's not right. Projected in 2020.
For 2023, yes.
So,
yes.
Yeah. So, all right.
Yes. So there is a
Yes, Representative Shaheen, I think has a question.
So the 735, do we add that to the total agency or the CPS direct delivery?
it would be added to both technically.
So the 735 is 100% CPS then?
The 735 would be considered 100% CPS if it was funded in-house at DFPS. So if it was something that they were paying state employees directly instead of outsourcing to
Right.
the
So you-
SSCCs, it would be a CPS employee, but that would also be an agency
Yeah,
employee, so it would bump both lines
We've
up.
moved to community-based care, the thought that that's more effective. So the 735 is 100% that, so. Okay, so to your point, you would actually add it to both numbers. Okay.
Correct.
You would add it to CPS direct and total agency, okay.
Yes, because the bottom line is a subset of the top line.
Got it, okay, thank you.
Yes.
Thank you, Mr. Chairman.
Thank you. Thank you very much.
Okay. So if you would now move with me to slide 5. Here we have provided a graph of the agency's non-child protective services expenditures beginning in fiscal year 2014, again with the fiscal year 2004 as an additional reference point. The functions on this graph include statewide intake, prevention and early intervention, adult protective services, administration, information technology, and other. And similar to the FTEs mentioned on the previous slide, the other function mainly consists of the expenditures in those programs that transferred to the Health and Human Services Commission in fiscal year 2018. But I will mention that in 2004, there were some additional programs that were transferred out even before 2014. So if you exclude these programs, you can see the expenditures outside of CPS at DFPS have been increasing over time as well. The largest increases since fiscal year 2014 are in the Prevention and Early Intervention Program, which is the light gray band, second from the bottom, and this has increased from $30.6 million.
For clarification, since it's,
Representative Mesa?
excuse me,
No problem.
I've been gone for a while.
Yeah.
So I forgot how to act. Thank you. Thank you, Chair. So just so we understand that there's, excuse the reference, there are different shades of gray here. So does it follow right along with the order that they're in here, going from bottom to top? Is that the way we can read it?
Yes, so if you're looking at the table on the very bottom, statewide intake is that first band on the bottom. Then prevention and early intervention would be the second band from the bottom, the light gray.
And as we read across,
Then-
we can keep going.
Yes,
up.
and it goes up.
Okay,
So,
great.
yes.
That's what I was hoping. Thank you.
Yes, that's a good question. So as I mentioned, the Prevention and Early Intervention Program, which is the second from the bottom, the light gray band, has increased from $30.6 million to $112.4 million, or 267%. Additionally, the administration program, which is the black band, second from the top all the way over on the right, this has increased from $49.9 million to $92.2 million, which is an increase of 84.9%. If y'all are ready to move to slide 6. This provides similar detail, but for the functions within Child Protective Services. So every program within CPS has seen growth from fiscal year 2014 to fiscal year 2023, with the cumulative expenditures increasing by 60.2% over this time and increasing 188% since fiscal year 2004. The direct delivery and program support functions represent the bottom 2 sections of the stacked bar graph. So you will be able to read this similarly than this previous slide. Direct delivery on the top left of the table is going to be the bottom stack. Then it goes to program support, which is the one above that, childcare, purchase client services, so on, from bottom to the top. So that's how you would read the stacked bar graph. So the direct delivery and program support functions, as I mentioned, which are the 2 sections at the bottom, these fund the entirety of the FTEs for the Child Protective Services. And the direct delivery function has increased from $476 million to $842.6 million, or 77%. And the program support function has increased from $42 million to $74.8 million, or 78.2% over this time period. And this is due primarily to the increase in CPS staff that was reflected on slide 4. In addition, the Relative Caregiver Payments Program has the largest percentage increase, with expenditures increasing from $10.4 million to $24.7 million, or 136.9%. And this is due largely to the increase of kinship care rates approved through House Bill 4 in the 85th legislative session. And I will note that that is a program that did not exist in 2004, so you won't see a stacked bar graph in that year. Okay. So on the next slide, slide 7, this just provides the biennial totals of expenditures that were reflected in the bar graph on the previous slide, just for your reference. So I won't be speaking to that. That's provided for your reference. So if you would now move with me to slide 8. Here we have reflected the unique number of children involved in the conservatorship, family preservation, and investigation stages in each fiscal year from 2014 to 2021. You can see that for the past 8 years reflected on the table, those involved in conservatorship and investigation stages have remained fairly constant, with reductions of 4% and 2% from fiscal year 2014 to 2021, respectively. The exception is the number of children involved in the family preservation stage of service, which has decreased 25% from fiscal year 2014 to 2021. This is due to a variety of factors, including the implementation of House Bill 567 passed in the 87th legislative session. Additional detail on the investigations function is provided on the next page. So on slide 9, the investigations function is a sub-function within the Child Protective Services direct delivery staff strategy. So for context, the legislature appropriates funding at the strategy level, which in this case is B11 CPS direct delivery staff, and then the agency, unless otherwise restricted, has the discretion to allocate the strategy appropriations to the various sub-functions as they see fit. And while expenditures in these sub-functions are reported to the Legislative Budget Board through sub-strategies, funding is not appropriated specifically at this level. Because of that, we have provided a table at the bottom of the slide that shows the legislative appropriations made to the CPS direct delivery staff strategy for each biennia since the 2014-15 biennium, along with the DFPS reported expenditures in the investigation sub-function on the bottom line. The CPS direct delivery staff appropriations increased from $958.4 million to $1.7 billion, which is a 74.7% increase. Biennial expenditures in the investigation sub-function increased from $370.1 million to $506.8 million, or 36.9%. You can see the allocation of investigation FTEs, which is shown in the bar graph at the top of the page, has also increased over this time period, going from just over 3,000 to almost 3,900, which reflects a 28.6% increase. Finally, if you would move with me to slide 10, here we have provided a list of some of the significant exceptional item and supplemental funding appropriated to the agency since fiscal year 2017. While this does not reflect all additional funding, some of the highlights include in fiscal year 2017, the $113.2 million with 828.8 FTEs that was provided to address critical needs of the agency. In 2018-19, there was $292.8 million that was included into the base to make sure that this funding would be continued. There was also $88 million and 597.9 FTEs provided for additional caseworkers, as well as the $32.5 million for the increased payments provided to the kinship care program that we mentioned related to House Bill 4. In the 2020-2021 biennium, there was $30.5 million and 98.2 FTEs providing for additional staffing support across the agency. Some of the highlights within that was funding for 17.9 FTEs in contract oversight and monitoring, 30 FTEs for additional CPS frontline staff, 13 FTEs for additional child care investigation staff, and 7 FTEs for additional screener staff. And finally, in the 22-23 biennium, there was $88.8 million and 478 FTEs provided to address the foster care litigation, $6.4 million and 42 FTEs for community-based care oversight staff, $124.8 million that was provided to address foster care capacity, and this does include the $90 million that was provided in the second called session, along with the $34.8 million that was provided during the regular session. And finally, there was $21.9 million that was provided for temporary emergency placements within the CPS system. This concludes my presentation, and I would be happy to take any questions at this time.
Thank you very much, Ms. Lindsay. Members, any questions? Okay. Yeah, that's right. Chair Now, or Representative Mesa.
So this is only my second term, so I wasn't here during some of these earlier years that you used for comparison purposes on your graph, but specifically looking at page 8 or slide 8, children involved in selected stages of service. It's noticeable that the numbers increased each year up until about 2017, and then from 2018 after that, the numbers decreased. Is there one particular factor or change that happened during that time, fiscal year 2017 to 2018, that caused the decrease?
I would say that typically within family preservation, that tends to be more susceptible to policy changes. Outside of that, I think is more just within the environment.
And I think if I may, as LBB, that's really not in the realm of policy changes. In fact, I've already sent a text to the commissioner saying we're going to want to talk about this later. I think we ought to ask her those questions.
That particular thing?
Yeah, this particular thing, because there are reasons. Conservatorship is different than family preservation, is different than investigations, and it's really not an appropriations issue as much as, I mean, obviously appropriations impacts that, but the decision of whether or not to bring somebody in or not is not something that is really a policy. It's more of a policy issue than it is an appropriations issue. So I do think we need to discuss it. I actually already gave a heads up to make sure.
Well, good.
I was like, I saw that here. We need to address it.
As they say, great minds. But since
That's
you were
right.
making the presentation,
Great
I thought
minds
maybe
think
you
alike.
might know the answer to this question. So
Yeah.
if it's not an appropriate question, I apologize.
No,
It is
it's
your graph, so.
No, it's appropriate. I'm just saying I think the better person to answer that would be the commissioner.
Okay, we'll ask that later then.
And I will say for 20 and 21, obviously with COVID, there were some reductions seen just with, fewer people being reported. And so there's obviously, some less people in the system. But as for the policy, I will defer that to the agency.
And some of the family preservation services, and again, we'll talk about that. So that's the outside of the court system that we talked about at length during session about, basically you can have removals or somebody almost forced to be removed with no intervention of the courts. And so I think that has been identified as something we would really rather, if we're going to remove a child, we would like the checks and balances of court oversight. And so there are a number of bills that have been filed, and also I think just internal policy changes that reflect that desire of the legislature, or that reported desire based on bills passed, comments made. But the middle ones are really outside of the court system. The conservatorship ones are the ones that are done through the court system. But we'll have that policy discussion.
To be discussed later then.
Yes.
Thank you.
Chair Niave.
Thank you, Mr. Chairman. Good morning, or good afternoon, rather. I wanted to ask you, and I don't know if it ties into slide 4 or if maybe just the data is elsewhere, regarding how much and correct me if I'm wrong on the term, but like a general residential operation or facilities such as the refuge, how do they get paid? Is it per day? Is it per FTE that's in here?
Yeah, so that's actually separate from the full-time equivalent, since that is services provided by the foster care providers. There are daily rates for various different levels of service that is included in the General Appropriations Act. So that is typically how most of the foster care providers get paid through contract that way. I will say, however, that there is flexibility for the agency to implement child-specific contracts in instances in which they cannot provide, they can't find a provider to give those services within the rate structure that exists, and it allows them to create a separate contract outside of that rate structure. But all of that would be contracted services. And for reference, there's a separate strategy in the General Appropriations Act, which is foster care payments. So all of those contracted costs would fall under that strategy. Obviously, there would be some administrative FTEs that handle contracts that would be shown under on slide 4 in those FTEs, but the vast majority of that is just handled through contracts directly with the providers.
So, and you mentioned that there are daily rates that are paid out. Is that per employee or per child?
It is per child. The rates are basically fully separate from the number of FTEs within the agency. So it's going to be based on the number of days that the child is receiving services and the level of services that they're receiving. So, if you have a child who is with the kinship care provider, they have one rate. If you have a child in the foster care system in a general residential operations, with basic care, then that's a different rate. So there's, it is, as I mentioned, going to be based on the child's needs and not based on the FTEs.
So if we have a situation such as the one that the girls were in the refuge, and I guess, can you tell me how is the refuge a general residential operation, or is it something different?
I would have to defer to the agency on the specific distinction that it falls under, but I do know that I believe that many of the contracts were child-specific contracts, placing them in that facility, but I would defer to the agency on the specifics of that.
So apart from the child-specific contracts, what is the general rate for circumstances where you have, what's the general daily rate for taking care of a child?
Rider 24 in the bill pattern for DFPS and the General Appropriations Act. I know you will not be able to read it from here. It is very tiny, but you can see it. There's many different lines that provides the different rates. And if you just want the basic foster family, which is sort of the lowest level of services, that's at $27.07 per day per child.
Okay. And so for a higher level,
But that is just
that's
very
the
low.
minimum.
So just
Correct.
how much is it for a more specialized facility?
So the highest amount that is listed in Rider 24 is $500 per day. But again, the child-specific contracts, the agency has the ability to set any rate. So this is the rate structure that the agency follows whenever they are able to find a provider that's willing to provide those services, but they have the ability to set a separate rate based on a child's needs, and that would be outside of the GAA, so that could be in any amount.
Any amount is pretty broad, so it could be thousands of dollars per day, or what?
I don't think that they typically go that high, but I would defer to the agency on more specifics on the average child-specific contract rates.
Would it be HHS agency or the DFPS?
DFPS.
Agency? Okay, so DFPS is the one that enters into these contracts.
Yes, they are the one entering into the child-specific contracts. HHSC helps establish rates, and so if you're familiar, there's a provision in the current GAA that is requiring HHSC and DFPS to look at changing the rate structure methodology. So HHSC is involved in that respect, sort of on the front end, helping establish the rates. But once they are set, then DFPS is the one that is entering into the contracts with the providers, and they would be the ones that would establish any child-specific contract rate.
Okay, so in the circumstance with respect to the refuge, you don't have the data to,
We can provide the contracts that have been submitted into our contracts database. The LBB does require agencies to submit contracts, so we can provide that to the committee if that's something that you're interested in. I just don't have that right in front of me.
and that'll identify how much they're getting paid per child, per day.
I haven't looked at a specific contract, so I can't say with certainty that it has all that level of detail, but we can definitely provide you what is in our database.
Okay, thank you.
Thank you. Chair Rose, do you have something?
Yes, thank you, Mr. Chairman. Julie, I just have a quick question. On page 8, you had made reference to a bill number that was done in the 87th regarding the changes in, up under the conservatorship, family preservation and investigations. You said House Bill
67.
567? I believe Representative Franks was a co-author.
Oh, no wonder he's jumping out there before I can even get it out.
I was just trying to help you out.
All right, thank you. I just wanted to go back and reference that bill.
Yes, 567.